Hold on. Sorry, everybody. Okay. So this is kind of some of the effective dates. Some of this we don't know yet because we're waiting for federal guidance. Some of it we do know, right? That as of yesterday, there's no SNAP defunding, and then some of these other changes. Um, okay, so if I can make this work, yeah. So
Sarah, I'm sorry.
yes.
This is Jenna Grasso with CBIA. My colleague Danielle Cloud, she now covers our workforce and childcare policy. I think she's still in the waiting room chat to be let into the call.
Oh,
I don't see her. I did just let Veronica back in though.
I
You
don't.
don't?
No, I don't see her either.
Oh, okay. Sorry to interrupt.
But
Well,
ask her to come back in. It tends to pop up on
yeah,
our.
she's done that a few times. Okay.
Oh,
Thanks.
sorry. Ask
Okay.
her. See if she tries one more time. She has not appeared in our waiting room. I hope she's not in a different waiting room. All right. And happy, by the way, Jenna, we can go over if she doesn't make it into the meeting, happy to talk with her offline.
Okay, thank you.
Um, so current state, right? There's no real work or community requirement engagements in Medicaid. There have been some in SNAP before that has also changed, and I think that's in here. Did I scroll down too many pages? Wait a minute. Because you guys are on the right, I can't see what page I'm on. Okay, hold on. Yeah, no, I didn't. Okay. So let me just note, well, Mel, that you'll go over the work requirements in SNAP later, I think, so it's fine. So work requirements in Medicaid are going to start in a year and a half, and those work requirements are 80 hours a month of work or income of at least 580 a month. And you can also do community engagement or unpaid work, 80 hours a month. Part of the challenge, or you can be enrolled half-time in an education program or some combination. The challenge with these is, and here's a bunch of exemptions that everybody should be aware of, right? So foster and former foster youth, veterans with disabilities, you can kind of read the list here and we'll send this out later. Um, there are a bunch that are helpful. Parent caregiver of an individual with a disability, for example. Um, the challenge though with this verification is you're going to have to verify your work or your education or your community service every 6 months. And so the question is how many folks are going to be able to do that? It's been 12 months now. Now it becomes every 6 months. Um, then there's some changes for certain non-citizens. And so these folks here um, are now eligible to apply and to use to be with Medicaid. But you will see that COFA citizens, which are the Commonwealth of something, it's some of like Micronesia, some of the folks in the Pacific Islands. Um, Refugees, asylees, parolees, victims of trafficking, victims of domestic violence, and Afghan or Iraqi special immigrants will no longer be eligible. Uh, okay. Um, and then right now, if I apply for Husky, we can retroact my coverage 90 days prior to the date of application, which means if I went into the hospital and then realized I needed Husky, then it's retroactive. That will go away to 1 month. And so that means that there may be an increase in medical debt because folks will not get that coverage from Medicaid. Um, and then there's some cost sharing starting in 2028, $35 per service if you are an income of this amount. And believe me, how complex this is means families are going to have a really hard time understanding kind of what they need to do to remain eligible and what they need to do to pay. And you can see some services exempt here. Um, so I think, I'm not going to probably go through the rest of these, but just to note that DSS is doing some work to think about the application and renewal journey and what they have to solve for, which I think is part of the challenge here is both at the application moment and then also at redetermination, to make sure that folks, or to help folks not fall off. Nationally, there's quite a sense that there will be millions of people who will fall off Medicaid because they can't meet all of the, they'll either forget, not able to document the work, all of that. So that's kind of one of the things we have to be aware of. And they're working with some client profiles. So, this is some of what Connecticut, what DSS is recommending, right? We need to expand staff capacity, figure out some modern tools, transform kind of how people are using digital technology, and then kind of thinking about policy and what can we do, and engaging partners. So that's an overview. Some of you have seen that. I'm going to do one more piece, and then I'm going to turn it over to Melvette. Give me 1 second. I have to switch to a different. Yeah. So the other thing that is going to be coming up, give me 1 second, is Access Health changes. So wanting to show those. Okay. So there is the expiring of expanded, the enhanced premium tax credits, which means that if you are in the exchange, your premium is going to go up. Some folks say it's going to go up quite significantly. I think that's still to be determined. And so there's an elimination of eligibility for financial assistance for those who are here but not eligible for Medicaid. So they will go out. It eliminates DACA recipient eligibilities. It eliminates a special enrollment period for folks with income 150% or less of the poverty level. Bunch of other changes here. So altogether, it's beginning to both increase cost and probably restrict access. So here you can see the concern by DSS, or the estimate, is that with the enhanced premium tax credit and the final rule and OBBA, it could lead to 30 to 35% of the currently enrolled population being uninsured within a little less than a decade. There is some tax credits are still available. So about 5,000 customers on their immigration status will no longer be covered. And the customer impact on the amount of maximum out of pocket may represent a 15% increase. So I think the rest of it there's a bunch of stuff about the tax credits in here to think about. So like 28,000 customers who are, I don't know why my computer keeps doing this, but who are income eligible, who have annual income over 400% will now lose all financial help. And there's 142,000 customers receiving financial assistance, and over 50,000 of those are in the Cover and Connect. So families have some changes coming, and then they have some recommendation. So some of this is new for you, some of it isn't. Part of the challenge here, and that's why I'm going to turn it to Melvette, is how to help parents understand this kind of crazy set of changes, crazy up, down, or around, just that it is so many changes and so challenging to help people understand and to get prepared for what's coming. So I am going to turn it over to Melvette.
Great. Thank you, Sarah. So we created a flyer to try to include some of these changes that we thought would be relevant for parents. I hope everyone can see the screen there. And so really just calling their attention to this thing is happening to you. If you don't know it or not, it's happening. I would also say, before people ask, my team is working on translating this in Spanish, so we should have the Spanish language version today or tomorrow. We're just tasked with a lot of things right now. So we'll get a Spanish language version out also, but really just focusing on SNAP at the top here. Just bringing some of these details to light for parents so they can hone in on it. So for example, if you're ages 18 to 64 and are single or a parent of a child 14 or older, you must participate in at least 20 hours a week of either paid work, unpaid or volunteer work or education, right? And I think a lot of folks don't know that this is coming. Sarah, do you want me to go through the whole flyer or just the highlights?
I think probably just the highlights.
Okay.
I think this is just to say, I think Melvet has tried to do, we've tried to kind of, how do we help families get
Right.
the essence of this? So maybe kind of
Yes.
show the overview. Yeah.
Yeah, so we just really call out. I mean, as you can see from the PowerPoint that Sarah shared from DSS, and there have been a number of different things happening across the state trying to get this information out. We just really wanted to pull out some of the important points we thought were going to be relevant for parents and families more immediately. So at the top, we add a little graphic for folks, and we call out some of the SNAP changes. And then on the bottom here, we focus on Medicaid. We also call out that Medicaid is Husky D because a lot of folks are thinking that they're not affected. Like, oh, I don't have Medicaid, I have Husky. I don't, right? And so this is going on across the country because every state calls Medicaid something different. So it was an intentional call out there to bring their attention to that, as well as some of the things that will be affecting non-citizens. And then this call out for access health on the bottom, right? So we included some timing. We also included a way to connect with the commission just in case people have questions or they can follow for updates. And so we'll have this in Spanish available as well. I think the question here, right, and especially with our two gym parent leaders and consultants on, it's like, how can we inform families about these changes, right? That's number one, right? So that this is a two-step process. What's happening right now, people are flooding, and I see your hand, Caroline, I'm going to come to you. People are really trying to get the information out. And there are a lot of competing priorities in people's lives right now and in government across local, state, and federal government. And also, we are in the midst of a shutdown that just got announced, right? And so it's not like people are going to be able to pick up the phone and get someone too, right, to answer their questions. So there's a flood of information coming out, but there also has to be action associated with when people get the information. It's almost kind of like saying, hey, here's this information, right? So a terrible example, but a good example would be you go to the doctor and they say you have cancer. Okay, see you later, right? Like this just giving you the information without any way to resolve the issue, to take action. What are your next steps, right? And so that doesn't happen, right? They give you the information and then they help provide some solutions or ways to take action to get better or to do something. And so I think that's the question here. That we have our parent leaders and consultants on with us as well as all of you. But how is it that we can inform families, but also help them raise their voices in with our legislators and folks who are in power so that they hear like, hey, my name is Sarah and I am a single parent who's 21 and I have a child and this is going to affect me. So maybe we can go to Caroline's question and then maybe Sarah can help us facilitate a discussion around that so that we can feel like we're moving to action on some of this.
Yeah. So sorry, Caroline, before you jump in, you want to just scroll down, Melvet, so people.
Oh yeah, I'm sorry.
That's
I
all
was
I was
scrolling
gonna
down on my
say.
other. Oh, I was
That's all I
scrolling down on
wanted
my
to
other
say.
screen. Okay, here we go. So here's the SNAP part. And then here we are with healthcare. So we kind of break it up to show that there's these two major areas affected. And then here's the commission information. I'm sorry, at the bottom, the AI assistant wants to help out there, so that they have someone to contact or a way to stay connected, right? Oh, I got this source of information from the commission. Here's where I'm going to go to try to get more information. Or if they want to call us, right, we can help connect them or help them understand how they can take action.
And then Caroline, before you jump in, just welcome Amy Peltier. I know you had something come up, so thank you for joining as the co-chair, and she'll talk about housing when we finish this dialogue. We will wrap by 11 o'clock for sure.
Mhm.
So Caroline.
No, I was just
She
gonna
just wanted
say
me to scroll.
scroll. Yeah, I was just gonna ask if you could scroll down. But thank you for the information. And I guess I don't know if I should wait until you start to facilitate the conversation, but when you said how do we get the stories out? That's just what it is. I think maybe I don't know if it's video that we create a video of different families saying this is who I am and this is how this affects me. And putting that on TV, online. Everybody looks at social media. Well, not everybody, but there are people on social media. But just creating PSAs is something that immediately comes to mind in terms of spreading this information and getting those real world stories out there. Not just, hey, did you know this is happening? But I got a couple ideas when it comes to that.
That's great ideas. Thank you. Yes, we are starting the conversation. Stefan, welcome.
To piggyback off of what Caroline was saying, I love the two slides that were put together, but I think we need an informational slide as well to where parents can find volunteer work or find some kind of educational program. The job part is easy, but finding volunteer work or some educational program may be hard for some people who don't have cell phones, don't have laptops, or don't have transportation.
Yeah.
So, a relative, like say, I know Melvette. Melvette sees the flyer and she brings me the flyer. I now have that flyer saying I can go to X, Y, and Z to get the 20 hours of volunteer work. So I think the third slide or the third flyer should be some kind of informational flyer where they can find the information to actually get the volunteer work or the education. Now, as far as the sharing the information, there's always cafes. There's always sending it to the school. There's always asking our partners to send out the flyers as well. But I love the idea of a video as well.
Great, Stefan. And when on your first point, and then I see Melvette and somebody else raised their hand. I can't see who. On your first point, one of the things I think about, I don't know if everybody's figured out a system for, right, the challenge of finding work experience in order to maintain your SNAP benefits. We didn't talk about one of the changes in SNAP benefits that is on Melvette's flyer, but is not exactly in the DSS presentation, is that before, if you had a child under 18, you were exempt from work requirements. Now it's a child under 14, and you are mandated to do work requirements. And it also goes up to 65. It used to be 54, and now it's 65. And so that's really challenging, and folks will lose their SNAP benefits if they don't participate. I don't know yet, Stefan. It's a really good question, and maybe we'll bring that back to DSS, how people are finding out where they can get work experience. It's a great question. And I think in particular, I'm doing some work in other states on rural issues. And for folks in rural communities, finding a place to volunteer may be challenging. If there's 20 of you, right, or 15 of you in a rural community, you can't all volunteer at the church in the same way, right? So, Melvette.
Yeah, I think, Stefan, you bring up some great points. One of the things that's currently in the works that happened before all of this was number one, the Secretary of the State has an initiative called Civically Engaged Organizations. So it is a robust list. I'm sure it's more than 200 at this point. And we are working together with the Secretary of State to map out those organizations. And that list, that map will live on our website. So it'll be a database that feeds into a map of Connecticut. And so you can click on Hartford and see all the civically engaged organizations. And if you click again, you'll be able to find out like what that organization does and do they have volunteer opportunities. That's one thing. The second thing that's new that really is not too much of public knowledge right now because it's still being shaped and formed. So launching in January of 2026, there's an organization I'm a part of called Common Purpose, which is going to focus on service opportunities, so volunteerism, and particularly we talked about yesterday the need for it in the context of these work requirements or volunteer requirements. So that information is not like ready, but I wonder if we can find something in the meantime more immediately, Stefan, to your point, to direct people to different websites where they can tap into some of those volunteer opportunities. I'm not sure about the workforce stuff, but I know we do have Anthony and Mike on, so I'll be quiet about that.
Thank you, Melvet. Shanae, are you here or not here? I can't tell from just letting you in again. I think she's not here yet. Dion, and
Nope,
then,
I'm here.
oh, you
Yes, she's
there?
got her hand raised too.
No,
Yeah,
I
I
know
was,
she,
I
I
was
know
on
she
my
does, but
phone.
she left for a while, so I wasn't sure if she was in. Go ahead, Shanae.
That was my question because Melvet was talking about the volunteer. So I do actually I work with the families, doing the work in city. So let's say parents come to me and I know obviously they're unemployed, but they want to do volunteer work. Am I somebody that can sign off for them to do volunteer hours? And if so, how do I do that? How are they reporting it?
So that's an excellent question, and I think we need to find out from DSS. Trisha, do you know what the system's going to be yet? I'm just curious. You're here from DSS.
I think, we're early in the process. So not all of that has been worked out just yet. I did put a link in the chat earlier.
Yep.
DSS has a website that kind of provides updates. So, as I said, being early in the process, there's a lot that we don't know. There's a lot of information on there that we do know right now, but they're going to be keeping it updated. So it's a place to go to follow the current developments as they move along.
Yes,
Thank you.
appreciate that very much, Trisha. There's also just, and then coming to you, Dion, in the chat, there's also a little bit about, I'm just looking for some of the resource here, and I see, Melvet, you've put in how to get in contact with your legislators. And Amy, you've put in Connecticut United Way volunteer by town. So just wanting folks to look in the chat to see those resources. We'll make sure we send them out. Dion.
I just wanted to put a plug in for something we're trying to see if that's something that would be helpful to others. Stefan is a little bit aware because he's going to be joining us as a partner. We formed a new Building for Health initiative. It's been around for a while, but we're trying it in a different way. And what we're doing is partners that are going to be able to send and receive referrals give us the green light to list them as organizations that accept volunteers. So when we help a family access a service, we ask them, would you be interested in volunteering for something? And if the answer is yes, then we link them with the appropriate org that their interests align with. So that could be an option for organizations that do help families, allowing them to also give back in a certain way, without having to go and search.
That's great, Dion. And I think it points to both what you just said and I think Shanae's question. We're going to need a system where organizations know how they can easily document that I, Sarah, have done my work experience so that I can keep my SNAP benefits. And the devil's always in the details on that. So just a note there. Veronica.
Maybe through the town halls, because I know at least in East Hartford, they have a volunteer group that are always looking for volunteers. Also, they can maybe be part of a commission. The town is always looking for participants in the town for being part of different commissions. And also them coordinate with the library. Maybe using the town hall, they can send that information to the library, to social services, to different agencies that they know that can use the volunteers. Even the registered voters office, even though it's only maybe once or twice or every 4 years, 3 times a year, we are always looking for poll workers. It's a stipend that we give them, and it's community service, civic service, and also through the schools, as that has been mentioned.
Great. Dion, and then Kate Reeves, if you're on, I want to call on you because I know that you have a bit of a website that you could have folks do. So Dion, thank you, Veronica.
I totally forgot one more thing. Another benefit to having the volunteer piece more visible is we know that the state is now going to be doing that student loan repayment program that could provide some financial relief for families. So that we should keep that in mind as well when we're talking about volunteerism. It's not just for you to maintain your SNAP, but if you have student loans, this
Yep.
is a really good opportunity as well.
Thank you, Dion. So, Kate, I don't know if you're listening. I'm hoping you are. If you could talk a little bit about the Connecticut project and how I saw a website that you've stood up to kind of help people know how to kind of be engaged. So again, we're trying to figure out both all of that work experience stuff. We're also trying to figure out how to just let parents know what's coming. Kate.
Yeah, no, happy. Thanks so much, Sarah. Yeah, the Connecticut Project has been running a campaign. I'll put it in the chat called Fight for Our Care. Kind of a couple of different angles on this. One is to certainly mobilize people and somewhat educate people. Although I really love the flyer that you've put together, Melvet, and we're, thinking maybe we should connect on that and how we can make sure we can get that out to folks too. Our first point is to educate folks to try to figure out how knowing that this affects them. We have an organizing team that's door knocking. They've knocked on like 10,000 doors, I think, to this point to try to get and mobilize folks towards trying to get the governor, we want to call a special session and to move $700 million into an emergency fund that would help cover some of these gaps. I think I actually have the number, so I just put it in the chat, the Fight for Our Care website. And this is how, people can get involved if they're wanting to tell lawmakers that this is important to them, share their stories, and then we have some resources there. I think we currently have, I was just looking at the latest updates. I think they just updated it. I think they have over 1,500 signatures from folks. We're running town hall. We just ran a town hall in Meriden, I think last week, and then we're going to continue to kind of pressure lawmakers to move on some of these things. So yeah, happy to please feel free to send it out and happy to put some more updates in there and I'll connect about how we can get the information that's already been shared on this call out too.
That's great. And we will be sending that, Melvet will be sending that flyer out once you have the Spanish one too. We'll just send the whole thing out at once. Does that sound right?
Awesome. Perfect.
Okay. Other thoughts on how you're reaching out to parents, letting them know? Mike Bartley, I'm kind of curious. Have you been letting some of the JFIS or Trisha actually too, JFIS parents know kind of what, especially around SNAP, if you don't have young kids, are you able to kind of let them know that they've got to start thinking about some of the conversation we're having here today?
We haven't started that messaging just yet. We want to definitely define the process first because, once you inform them, they're going to be asking, well, does this qualify? What does it take and whatnot? What I do know is that we're going to probably move forward with the simplest process possible as far as it goes with verifying work requirements. But I think that the guidance needs to be issued, at the federal level before we can definitively do that.
Yeah. And that, by the way, may be completely held up because we don't have a federal government operating right now. Welcome to the shutdown.
And on our end, Sarah, if we can get copies of Melvet's flyers in English and Spanish to me, we'd be glad to share those with all of our JFIS parents.
That'd be great. Thank you. Okay, anybody else want to share what you're thinking about or doing? Okay. Thank you. We took notes. We'll kind of write these up and send out to folks some ideas. I hear a lot of both interest and concern about how to figure out the work requirement piece, which makes lots of sense. And Trisha, I hear, which makes also a lot of sense, what's the right process? How do you even figure out how to verify that somebody's done community service? And if we don't have that guidance from the federal government, it may be a little on pause for now, but let's make sure that we kind of keep connecting the dots so that parents are informed. To Kate's point, letting legislators know what you care about. Melvet, I think you made that point too. So thank you for the good thinking. I am going to turn it over to Amy Peltier, the co-chair, to talk a little bit about the housing legislation. Amy, you're here somewhere. I can't see in the boxes. Sorry.
I'm here.
Oh, there you
Sorry
are.
to be sorry to be late. I actually don't have much of an update. As many of you probably know, there was a bill, House Bill 5002, that passed in both chambers of the legislature last session, and then it was subsequently vetoed by the governor. I think one of the reasons why we set this meeting on this date was because we were hoping there would be a special session scheduled to discuss, a new housing bill, as well as some supports for, the impending Medicaid and SNAP cuts. But there's no special session on the calendar yet. It's still a mixed bag as to whether there will be a special session. But I think the general kind of thought is, it wouldn't probably be worth it to have one if it were any farther out than the last week of October. So I think that's what some people are thinking about. There are allegedly still discussions happening about a housing bill, but no full agreements yet. I think, I'm happy to share what I think are, and I work for the Partnership for Strong Communities, and we're a housing advocacy policy and research organization. So we're active in the legislature and have been watching this closely and talking with our representatives and our lobbyists. And there's just still a lot of negotiating. I think some of the big hangups are around sort of the fair share model, and the concept that each community should be, kind of developing their own fair share of affordable housing. There were no mandates in the bill. Unfortunately, there's a lot of misinformation that has been spread about the bill and mandates. There were recommendations, and then I think ultimately the language was such that your town would have a recommendation, and then the recommendation part B was that you only have to come up with 25% of that recommendation. So I think there's been a lot of misinformation about it, but I think that's really the kind of deal breakers around local control and zoning, fair share, and parking reform. Those tend to be kind of the deal breakers. But what I would say is there were some great pieces in the bill. I don't know if they'll still be there, but at the partnership, we're really hoping that the pieces around town affordable housing plans and municipalities having to submit those every 5 years, as opposed to every 10 years, and that certain towns based on their demographics may have different requirements. I was actually just at my town's affordable housing plan meeting last night, and I was really impressed by the folks that kind of ran the meeting and ways that they brought people into that conversation. But there are some important pieces around homelessness, and sort of an attempt to create more cohesion between services and organizations that are serving the homeless. There was some stuff around hostile architecture and a portable services pilot, which are mobile showers and laundry services. We're also really in support of policies, and it would be great if they would be included, that support tenants. Tenant instability is kind of on the rise. Fair rent commissions are one tool, and expanding them was part of that proposed bill. There are also several direct rental assistant pilots that are happening in the state, but also the bill had pieces around authorizing nonprofit organizations to administer those and expand those to folks that are on voucher waiting lists, because there are not enough vouchers. Only 1 in 4 people who qualify for a voucher receives them, both in our state and nationally. And then there were several clauses around middle housing, which often means developments that have 2 to 9 units in them, and making it easier, providing technical assistance to be able to expand middle housing in communities and that may have stricter zoning. And then there's some stuff around first-time home buyers. But I will say the biggest challenge is for folks that are at the lowest income earning threshold, where they have the fewest options around affordability, accessibility, livability, and then really rights as tenants in those interesting power dynamics that can happen with landlords. So it's really a wait and see. I will drop in the chat a link that you can use to sign up for our mailing list. We do really comprehensive reviews of legislation. We also offer all kinds of educational opportunities, both in person and on webinars, to learn more, to understand more about what's being proposed, and then also how to kind of lend your voice to the advocacy. And I'll just close on that thought, is that it's really important, not only, I like Caroline's point around, making videos that, letting people know that really important changes are coming to folks who need SNAP or Medicaid, but the same thing with housing. We need to let people need to let their legislators know that housing matters, and that we need a comprehensive bill, and we're really behind on developing all kinds of housing, but really in particular multifamily housing that's affordable. So reach out to your legislators. Even if you don't know bill numbers, you can say housing is important to me. We need a comprehensive housing bill. But I will drop I'll drop both my email, but also how to sign up for our mailing list in the chat. And if you sign up for that, we will let you know when there's a special session, and as we enter the short session next year, what that will look like and what our priorities will be. But again, we're really focusing on tenant stability and those at the lowest income earners and their stability.
Thank you, Amy. Stefan, I see your hand up. So super helpful, and obviously of significant impact to families because of the importance of housing as a basic stability factor for moving ahead. Stefan.
So my question goes back to the Husky D. If you are an American-born citizen, but your parents are not, how does that affect your Husky?
So if you're DACA.
Yes.
I believe you still get it. I think that's right. Trisha's nodding her head.
If you're a citizen, you're a citizen.
Yep.
Okay, so if your parents are...
Can I just say for a second, my understanding from Connecticut Legal Services, and they were going to try to join today to talk about some of this, but my understanding is that DACA recipients would be impacted by the limits on health coverage. That's coming from Connecticut Legal Services.
Okay, we should get clarification. Amy, maybe we can link up with them and give clarification to everybody on that, because that's a huge population. Trisha, do you have other information?
No, I just, generally, I'm not a Medicaid specialist. I oversee the cash programs, but generally when we're looking at eligibility, and like I said, I'm not 100% sure about every change that's going to happen with Medicaid. We have that summary that says, these folks are included, these folks aren't. But so I'm not sure if all of the Dreamers citizens, because I think some of the ones that are of concern are if they came over as children and they're not citizens.
Yeah.
And they're here, they didn't, they were children, when they came.
This is like the devil. This is the detail that is going to be
Yeah. So, but
over and over.
normally citizens, if you're a citizen, no one really cares, where your parents came from and what their citizenship status is. You get what I'm
Right,
saying?
but Trump was trying to get rid of birthright citizenship.
I know. I don't think
So
that that's changed yet,
that
though.
that's where the question comes from, because I know a lot of people in Hartford whose parents um were refugees, but they were born here, so they became citizens. And after
So,
Trump did his whole spill of getting rid of the birthright citizenship
so
and everything getting ready to roll out, how does that affect them?
That's not been changed yet, though, Stefan.
Right.
That has to go through the Supreme Court.
yeah.
If I think to Trisha's point, if you were born here and you're a citizen, it's irrelevant where your parents came from, and birthright citizenship has not changed at this point.
And I don't think it would be retroactive. I mean, I have no idea. You see all kinds of crazy things lately, but I think if
Right
it
now.
was changed, that it might be like, going forward.
Yep.
Yeah, I mean,
But
if it
we'll
were
have to.
retroactive, the vice president's wife would be affected. So I doubt that's going to happen. Just saying.
Oh, I don't know. They'll make some exemptions. Caroline, did you have your hand up? And then we're going to wrap up.
I did, but I think I'm gonna withdraw the question. It was about the birthright citizenship and
Okay.
the retroactiveness of it potentially, but it's another conversation for another time because it hasn't happened. So,
All right. Any other comments or questions before we close? Any intel on the housing beyond what Amy's offered? Any other thoughts on outreach? All right. So we will make sure that folks get all the resources. I know there's a bunch of stuff in the chat that we can utilize. Some of the stuff from the commission, from the Connecticut project. So we will make sure that we get that for everybody. And I think we'll wait a day or two, Melvet, until the flyer is ready, and then we'll send all the resources out to everybody. Does that sound okay? All right, we appreciate everybody. Hang tight in our new government shutdown at the federal level and in all the changes that have been coming, will come, and continuing to put families first and their children in our minds and how to support them. So appreciate you all. And Melvet has one more thing to say. Yes,
Yeah,
Melvet?
I just need to do a plug for a couple of things. And since this is the Family Economic Mobility Group, I would love to invite all of you to attend one of our listening sessions that we are hosting statewide. We're doing about 20. So you can go to our website under the events page. And we would like to hear about those issues that are preventing people from living their best life and having sustainable income and supports. As well as a plethora of things. We're also hosting our Latino Policy Summit on Saturday at the Legislative Office Building. It's a free event. You do need to register for it because right now we have over 300 people registered. We know that they all want to attend, but we're getting to be space limited. So we'd love to invite people to come to that as well.
And Melvet, I'll get from you where on the commission website the other is, because it'd be great for people to lift their voices in your listening sessions.
Yeah.
We are doing a housing cafe tomorrow with Melville Foundation. We would love to invite everyone to come out and be a part of the housing cafe. I'm going to try to share the flyer in the chat if I can figure out how before we kick off.
Stefan, why don't you also just respond to the email, the calendar invite, and you can attach the flyer and let everybody know since it's tomorrow. Like things that are a little further out, we'll put in a compendium, but something tomorrow, just respond to the calendar invite, hit reply all, and send the flyer that way. It's going to reach more people.
Thank you.
Okay. Anything else? All right. Appreciate everybody. Be safe. Get warm because it's getting cold.
Thank you, everyone. Bye.
Thank you. Take care.
Thank you.
Bye. Thank